High blood pressure is often called the silent killer. But did you know it doesn't always stay silent? Actually, your body could already be giving off you warning signs that something is wrong. You simply need to know what to look for. And today, we are diving into the top 7 symptoms of high blood pressure that you should never ignore. Some of these signs might surprise you, others could save your life. And make sure to stick around until the end of the video because the last symptom may be the most astonishing of all. Let's get started. Did you know high blood pressure can cause severe headaches and sometimes accompanied by pounding sensation in your ears? But these headaches could be dull or could be intense, but if they are sudden, severe, or unlike you've felt before, it could be a sign of a hypertensive crisis. And a hypertensive crisis is a medical emergency. If this happens, don't wait. Call 911 or head to the nearest emergency room. Blurry vision. Have you ever experienced blurry or double vision? This symptom is a major warning sign of high blood pressure. The tiny vessels in the back of your eyes, called the retina, can get damaged due to the chronic high blood pressure. And this condition is known as hypertensive retinopathy and compromises the blood flow and could lead to even permanent vision loss if untreated. What should you do? You ought to drop by your eye doctor's office for a thorough exam. They will dilate your pupils, they will look in the back of your eyes, and they can tell you clearly if your symptoms are caused by high blood pressure. Here's a quick question for you. Have you ever been diagnosed with high blood pressure and only realized later that you had symptoms before? If so, share your experience in the comments below. Nosebleeds. Let's talk about nosebleeds. While not everyone with high blood pressure experiences them, frequent unexplained nosebleeds can sometimes indicate dangerously high blood pressure levels. Again, the delicate vessels in your nose can rupture under increased pressure. And if you have a nosebleed, you need to lean forward and apply pressure in your nostrils for about 10-15 minutes. And if the bleeding does not stop, you could try again another 5-10 minutes. And if you still continue to bleed, you need to seek medical attention. Shortness of breath. Are you finding yourself out of breath more easily than before? Maybe climbing a flight of stairs, or maybe walking to your mailbox and coming back now leaves you huffing and puffing. Shortness of breath is another symptom of high blood pressure and one you should not ignore. This happens because high blood pressure strains your heart and lungs, making it harder to circulate oxygen efficiently. Over time, it can lead to fluid buildup in your lungs, a condition called pulmonary edema, which makes breathing even more difficult. If you experience sudden or severe shortness of breath, don't wait, seek medical attention. Let's look at fatigue and weakness. Feeling drained all the time? Chronic fatigue can be a subtle but serious sign of high blood pressure. When your heart is overworked, it must pump harder to get blood flowing throughout your body, leaving you feeling exhausted. Muscle weakness is another red flag. If you suddenly feel focal weakness in your arm or in your leg, in your face, especially if it's one-sided, this could indicate a stroke, which often caused by uncontrolled high blood pressure. If you notice any of these symptoms, don't delay. Call 911 immediately. Time is of essence. Chest pain and back pain. Here's one you should never ignore. Chest pain. High blood pressure is a leading cause not only of strokes but heart attacks as well. If you have severe chest pain, usually on the left side of your chest, it could radiate to your left shoulder, to your left arm. It could radiate to your neck, to your jaw. And sometimes you could have chest pain in your right side of your chest, radiating to the right shoulder and right arm. This could be a sign that you're having a condition called unstable angina, or even you're having a heart attack. If this pain persists, you need to call 911. What about severe back pain? Yes, back pain can also be linked to high blood pressure. In rare cases, it may indicate aortic dissection. It's a life-threatening condition where the inner layer of the aorta tears. And if you experience sudden severe back pain associated with high blood pressure, go to the emergency room immediately. And here is the most important symptom of all. The most frightening symptom of all is nothing. You have no symptoms. That's right. High blood pressure often has no symptoms at all, and this is why it's called the silent killer. You can feel completely fine and have dangerously high blood pressure, and many people only find out they have severe high blood pressure after experiencing a major event, a heart attack, a stroke, or even kidney failure. Regular blood pressure checks are your best defense. You need to know your numbers. There are no excuse for it. And let me tell you a bit about my experience in New York City. I did my internal medicine training in Brooklyn, New York, and we had a large population of African Americans and Puerto Ricans as well. And it was not uncommon to see people in their 30s, in their 40s coming into the clinic not only have a very high blood pressures, but already having organ damage, many with renal failure already. So severe high blood pressure may not give you symptoms at all. When to go to the emergency room? Well, here are some red flags to watch. If you have any blood pressure reading 180 over 120 or higher, this is called a hypertensive crisis, and you need to go to the emergency room. And obviously, if you have severe chest pain, if you have severe shortness of breath that started suddenly, if you're having severe back pain, these are red flags that you need to seek emergency care. It could make a difference between life and death. And obviously, if you're having weakness in one side of the body, could be a sign that you're having a stroke as well. And if you want to learn more how to lower your blood pressure naturally without medications, watch this video, high blood pressure, top 10 foods to avoid. I'll put a link above and on the description below. And remember, your health, your most precious asset. Take control. See you next video.